Most people think about skincare as something you apply: creams, serums, treatments, routines. And for a long time, that makes sense because topical skincare does have a clear and important role. But as skin changes with age, many people start noticing a gap. They're consistent with products, yet results feel partial or temporary. The skin looks cared for, but not fully supported. That's where the difference between topical skincare and internal skin support becomes important. Topical skincare works from the outside in. Its main functions are protection and surface regulation. Moisturizers strengthen the skin barrier and reduce water loss. Sunscreen limits UV damage that accelerates aging. Certain actives influence exfoliation, pigmentation, and superficial cell behavior. These effects are real and valuable. They help preserve what skin already has. But topical skincare operates within biological limits. It primarily affects the epidermis and the uppermost layers of the skin. It cannot directly rebuild collagen fibers, restore elastin architecture, or correct deeper structural decline. Internal skin support works in the opposite direction from the inside out. Skin is a metabolically active tissue. It depends on circulation, nutrients, hormones, immune balance, and cellular repair systems. Collagen and elastin are produced internally. Cell turnover is regulated internally. Inflammation is driven internally. Blood flow determines how well skin receives oxygen and nutrients. As we age, these internal systems change. Collagen production slows. Repair becomes less efficient. Low-grade inflammation increases. Circulation becomes less robust. These shifts alter how skin behaves long before surface changes are obvious. This is where confusion often appears. People expect topical products to correct changes that are no longer surface-level problems. When results plateau, they assume they're using the wrong product or not doing enough. But the issue isn't effort. It's alignment. Topical skincare protects and maintains. Internal support determines how well skin repairs and adapts over time. Nutrition plays a role by supplying the building blocks for skin structure. Sleep supports repair cycles. Stress regulation limits inflammatory damage. Circulation ensures delivery of oxygen and nutrients. These factors don't replace skincare, they create the conditions that allow skincare to work as intended. This doesn't mean internal support produces instant visible changes. Its effects are gradual. They influence the rate and quality of aging, not sudden transformations. That's why internal support is often underestimated. It's quiet, cumulative, and long-term. When topical care and internal support are aligned, results tend to feel more stable. Skin still ages, but it does so with more consistency and less volatility. Texture changes more slowly. Recovery improves. The skin feels less reactive. Understanding this distinction also removes unnecessary pressure. There is no single product that can compensate for chronic internal strain. And there is no internal approach that replaces basic surface protection. They are complementary, not competing. The real issue isn't choosing between topical skincare and internal support. It's expecting one to do the job of both. When you understand what each is responsible for, decisions become clearer. Skincare becomes more strategic. Expectations become more realistic. And frustration decreases. If you want a structured breakdown that explains how internal support and topical care work together in a realistic way, there's a practical resource linked in the description. And if you value calm, evidence-based explanations about skin health and aging, consider subscribing. Seeing skin as a system, not a surface, changes how you care for it long-term.